Hi, this is Dr. Supreeth, working as consultant medical oncologist at Sri Shankara Cancer Hospital and Research Center, Paswangudi, Bengaluru. When it comes to young cancer patients who are unmarried, who have not completed their family, it is important that we as oncologists discuss fertility preservation strategies with these patients, because chemotherapy drugs can end up affecting the fertility of a patient permanently also. Young patient is suffering from completely curable cancer. It is important that where the patient is expected to survive for many years, is likely to get married, have his or her own children, we make sure that we discuss fertility preservation strategies. So what are these strategies? In females, there is the foolproof method, or the best method for fertility preservation is something called oocyte preservation, wherein you are collecting egg from the patient and preserving it at certain cold temperature, so that egg can be used for future purposes and the patient can conceive by means of in vitro fertilization. Second strategy is a medical strategy. This is not a foolproof method, but what we do here is we give certain injections to block the function of ovary. Basically, you are shielding the ovary from the ill effects of chemotherapy, thereby protecting it. But this is not completely foolproof method. The chances of preserving fertility by this method are only around 10 to 20%. But if somebody is financially constrained, this is something that we prescribe to the patient. When it comes to men, there is only one effective method, which is sperm banking, wherein we collect sperms from the patient before starting chemotherapy, and again it is cryopreserved or preserved at cold temperatures and can be used for future purposes for in vitro fertilization or otherwise. And second method, which is still in the research phase, is testicular tissue banking. So again, this tissue from testis is collected and preserved at cold temperatures and can be used for future purposes.